But everybody in the audience knows I just did one thing right. I lived a long time. And I'm happy to be here. This is one of the really bright spots in the American fight for social justice and health. And it's thrilling to just see an auditorium this size filled. Hear a congressman give these enlightening remarks, which direction this goes. I'll try and give a little bit of the history and where we are today, and sit down so you can hear some really interesting speakers. When I was in training, the AMA was the dominant voice in American medicine. It had been founded in 1847 in Chicago, and in the 1940s, when I went to college and the Army, the AMA was the ultimate decision maker. So much so that in 1950, the AMA executive director wrote to every dean of every one of the medical schools, telling them to tell the medical students that if they did not withdraw from the Association of Interns and Medical Students, AIMS, that these students would not graduate. And the AMA could do it, and the authority was unchallengeable. Indeed, the first defeat the AMA had on health policy was 1965, and what happened then? Medicare, exactly. It was over AMA objection, but Johnson, being very, very skilled, wily politician, made it happen. Now, they were only partially successful. Medicare covers people over 65, and later people who are totally disabled were added to the list. Now, you can tell without much examination that that's the most needy part of our population, people who are elderly or people totally disabled. And the system, the dominant health system under AMA leadership, was reluctantly willing to give those people up. And as a practitioner, both in public hospital but also in private practice, I would assert categorically without fear of any contradiction that Medicare is an extremely popular program and makes a huge difference to the lives of elderly people. Let me give you one example of what that comes out to. Well, today in America, there are about 16% in poverty, defined by their income and cost of living. And I fear that's going up. But if you took their Medicare benefit away, did nothing more but that number would rise to 32%. That's how powerful Medicare for all seniors has been. And it's an enormous asset to those of us in the fight for single payer, because we don't have to point to Canada or Western Europe or any of the other 19 countries that have adopted successfully and much more cheaper, if you please, than we, systems that are popular and with better results than we have with our costly system. And to indulge me in a few statistics, it is a costly system. In 1950, after World War II, the entire health system in America, of course the total expenditure of the society was less, was $22 billion from the first aspirin for the last day in the hospital for that year. Now, we look at a system last year that cost 2.7, brace yourself, $trillion, 18% of the whole gross domestic product. We can actually say, if this audience anywhere we're advocating for health reform, that the economy and the well-being of the whole nation is at stake in the health care issue. It's not merely, obviously, it is very important from the point of view of humanity, of solidarity, care for the ill, something that is traditions in American medicine and American society. But we took a wrong turn when we enhance the power of corporations to control the health system. And that 2.7 trillion includes literally tens of millions of dollars in executive salaries. 34% of that money that goes to marketing, employing for what they do, marketing their product. And I think it's very important for those of us who are advocates to recognize this is a problem in America. We have other ones of great magnitude, but this is a problem that has the resources in place. The hospitals, the physicians, the money, and we would not have the ignominy of 50 million Americans without any insurance at all, another 50 million with very poor insurance. The health system does horrible things in terms of the whole society. Specifically, 1 million every year, 1 million Americans go into personal bankruptcy. That's 1/2 of the total, 2 million each year. That's what the health system has turned into. And to many people who have illnesses and have to rely on limited insurance often or no insurance, this is a real catastrophe. And those of us who practice medicine know its importance to people to have access to it and confidence that they won't be economically destroyed by a major illness. They are with us. Indeed, we have a popular idea. Over 69% of Americans when polled answer yes to the question, do you support a federal government support free taxes of the health system and in the word they define, give a single payer option. 69% of Americans today say yes. This is a change. But what's more interesting and important, you should grasp this fact, doctors now in the majority support single payer. 59% of doctors say yes to that question. Doctors, I thank you for the applause. But what they've learned, and this is really important to everything they do these days, they've learned there's something more efficient than government. Doctors are a very conservative group and have the usual taboos about government and government answers to questions. But they found out that the corporations are much worse than government. We're really learning that truth, and it's that we have to wait because it would be ridiculous for you to leave this meeting without an awareness of the power of the opposition to single payer. It's awesome. Even those of us who try to keep up with it, the dollars involved are breathtaking. They have 34% of a $2.7 trillion enterprise, and they're not afraid to spend it. And then the recent Supreme Court rulings about corporations, as you know this, are people, and they can spend $90 billion against the modest we're able to raise. So it's an unequal fight. And I can't say with absolute confidence how it's going to turn out, but I have a reputation for being optimistic sometimes in the book. But I rather think we win this one. American people take seriously their health care and cherish it. And I think, as the Congressman pointed out, there'll be signs of this wish for decent health care. And I do agree with him that it will almost certainly be through the states at first. And if I may give you a brief lesson in American political history, that's how most of the important things we have took place. A state with progressive states like Washington or Wisconsin, where they're going to recall that idiot. From the larger point, which is that we have a society that's ready for single payer. But being ready has different stages, and there's a popular idea. We've had that. Women's suffrage was a popular idea. The end of slavery was a popular idea, but it didn't happen until it became a movement. And that's a real entity that we have to conceive. We are in the foothills, in the place of becoming a movement, single payer effort. But seriously, that's a concept we should grasp. You folks are at the beginning of a movement, and we just develop that. That's good. That request or demand from me, I'm ready to give it to you. Well, I've been asked to touch on a few other things which I'll try and do before I use up all of my time. But it's worth saying that we do derive an enormous advantage from the single-payer movement that we have, which is Medicare. Now, bear in mind, we say improved Medicare. Why? Because while the airman and his allies couldn't defeat Medicare in 1965, they did some grievous harm. They have co-pays and deductibles, which are not economically necessary. And it's obviously a class thing. If you're poor, that co-pay and deductible is ominous, and maybe you're unwilling to seek health care because you can't afford that. And so we have a battle there. So we always say we're for Medicare for everyone, but improved Medicare without the co-pays and deductibles. It's a comprehensive preventive program. And we know that this will work. It's amazing, a paradox that American science is way ahead of American economics. And I can tell, I'm certain, anybody in this audience, they filled the whole upstairs. But we have to have a situation where people are allowed to express themselves. And I agree with the Congressman completely that several states are going to make it happen first. And let me describe what I argue in the PNHP nationally where the strength is. The three states that are in action are actually on the eve of enacting a single payer in their state. Vermont, where the governor ran and got elected on a single payer program. The both of their legislature have passed enabling legislation. I don't want to leave you with the idea they've got a single payer system. They don't. But they're doing all the necessary steps. The ERISA waiver, for example, that we heard earlier. Another state pretty close to you all is California. As long as Schwarzenegger was in place and should have vetoed it, they passed it regularly, both houses by 60%. Now they have a liberal who has worries, and I don't know this for sure, but the recent vote, the vote that failed, instead of the 21 senators they needed to keep the bill alive, they had 19. It wasn't the other two voted against it. They just went to the bathroom. And that's, in terms of enactment, that's as much as voting against it. So people in California have a past. I just come from there, and I want to assure you, they recognize the past, and they're going to make Governor Brown live up to his reputation that he claims and bring to that United States, which has a serious deficit problem. Single payer is part of the solution of everything, the health care needs of people and their deficit. Now, the third state you may not have heard of is Hawaii. The president, the newly elected governor of Ohio, is one of the sponsors of House Bill 676, which is the embodiment of single payer. And the legislature, for some years, has been in favor of it. So that island in the Pacific may well be leading the way and be one of the states that Congressman told us about that will be stepping stones to a national system. But I do want to emphasize that in supporting state efforts, and we do, let me quickly add that in addition to the three I've just described to you, so at least 20 states, this state for sure, Illinois, where we have introduced the single payer legislation, but it's far from being enacted. And we have to work hard in all of those states. But the whole concept, the take-home message, I think, for this evening, that we're going to enact it in several states. I pray that Washington is among them, and I can see it happening. You have a very progressive tradition. And yes, Wisconsin, which is about to oust its right-wing Republican governor, may well resume to that state's role as a progressive one. So this is the excitement of the next period. And I'm sure everybody might recognize I can't guarantee that this is going to be successful. But I think it will be. And because we listened to the challenge over the decades, I'm old enough to have been part of the civil rights movement, the anti-war movement, we finally succeeded. But let's not forget women's suffrage in the early part of the last century, and even slavery, although we had a little more. The American people finally had their popular will expressed, and that's so it is with the single payer deficit. So I'll stop here. We have some really, really good speakers.